Good evening to all doctors. I'm Vijay. I'm thrilled to welcome you all for today's informative webinar on role of botulinum toxin Botox in cosmetology practice. I'm Vijay, manager at Mediversal Academy, and I have the privilege of introducing the speaker of the day, Dr. Prachi Mishra. Dr. Prachi Mishra is currently working as assistant professor at ITL Dental College, Greater Noida, and practices as consultant at various clinics in Greater Noida. Over to you, doctor. Doctor.
Yellow, green, and earthy.
Good evening, all. This is Dr. Prachi Mishra, oral and maxillofacial surgeon. We are going to start off with the. So, Mr. Vijay, may we start off with the session?
Yes, please start, doctor. Please share the screen and you can start.
Okay. So this session of ours is in continuation with our previous session where we have discussed about the science of facial aging and all the treatment modalities which are available. So taking that one step forward, today we will be discussing on the most potent, or we can say the most popular uh, tool of anti-aging, that is Botox. So now the question arises, what is Botox? So Botox is basically it's a botulinum toxin or botulinum neurotoxin. Vijayji, can you kindly shift that logo of which I'm getting on my screen? It's actually hiding the text over here
Don't, the
of
text.
mine.
So there is nothing hiding here. You can continue.
No, actually my text over the screen is hidden by that. Okay, now it's fine. So we were discussing about what the Botox basically is. It's basically a neurotoxin. So it's highly potent neurotoxin protein produced by bacterium Clostridium botulinum and related species. It prevents the release of neurotransmitter acetylcholine from axon endings at the neuromuscular junction, thus causing flaccid paralysis. So now, so far, you must have understood that it's just not having a role in managing few of the aging properties, but also we will see in upcoming slides that it has a role in various problem related to muscles even. How we can resolve the muscular problem even just because it's a neurotoxin. So basically it blocks the acetylcholine, which is a neurotransmitter released from the motor nerves to give the signals to the muscles for further action. So once that neurotransmitter is blocked, that means the signal which the muscles are getting for the further action is ceased for that moment of time. So in that way, muscles won't be able to perform any action or take any action. Hence, they are in a state of paralysis. But this property of getting paralyzed is not a that won't be considered under any medical condition, because intentionally we are doing for achieving either a specific or desired result or relieving our patient from any condition of pain. Now let's see how does this Botox works. So in this diagram, which is right in front of your screen, you can very well compare between the two. Here, this is your axon terminals, the nerve endings from where this acetylcholine, which is a neurotransmitter, is getting released. And once it gets released, it gives the muscles the message to perform an action, right? So once Botox is injected, they Botox stops the chemical message reaching the muscles, hence it reduces the movement. So this is the basic property which we will be using for performing any treatment related to Botox. Now, next is types of Botox which are available. So basically, there are 7 distinct forms of botulinum toxin ranging from A to G. 4 out of these, which are A, B, E, and rarely the F, causes human botulism, and type C, D, and E causes illness in mammals and birds. So among all the available Botox, the one which is most widely used is the type A. So now let's see what are the various variants of botulinum toxin type A which are available in the market, and what is the trade name and what is the salt of that. So this the very first one is the Botulinum toxin A, which is known by the name Botox. So we commonly keep on using the term Botox. That is stands for Botulinum toxin A, and so on. All these names which are mentioned over here are the variants of type A botulinum toxin. Now the most important part is how we will be using this Botox for our use. So in market, actually Botox is available in a solid powdered form, right? In a 50 unit vial either or a 100 unit vial. So for infusing that, you need to convert that into a liquid medium. So how you will dilute it? Firstly, if you're having a 50 unit of vial, so the final thing which you need to do, what the diluent or the solvent we will be using, that will be NS. Normal saline you will be using for diluting that. And it is, you can see here, it is said that approved dose is 4 units per zero point 0.1 ml at each of the 5 injection sites. So what does this mean? That means ki the approved dose is 4 units. So ultimately we have to prepare 4 units. The final resulting dose should be 4 units. So how much normal saline is required in ml to dilute a 50 unit of vial? So you can very well see here, if you're having 50 units, so we will dilute it with 1.25 ml. So once you will divide 50 by 1.25 ml, then you will get 40, and 40 stands for this 4 unit. So ultimately you have to make 4 unit. So that depends upon ki which vial you are having, and accordingly you will decide the volume of NS to get that 4 unit. So the thing which you need to remember here is that approved dose is 4 units per zero point 0.1 ml at each of the 5 injection sites for a total dose of 20 units per zero point 0.5 ml. So this is the most important thing for how you will be using or infusing the Botox. Now let's come upon the medicinal uses of Botox. So far you have seen that we are using that for any kind of cosmetic procedure, right? Apart from that, I have also mentioned initially that it is also used for number of medical properties. So what are they? Let's see from the very beginning. It is used for facial wrinkles, that is one S kind of appearance. So where it has, if it is seen, you must have seen the in the sign of aging at the glabellar region, you just get like that parallel, two parallel lines, right? So, and this is a sign of aging. Then we have crow's feet wrinkles on the face besides the eye. Then forehead wrinkles, jowls, chin dimpling, gummy smile, nasal flare. Apart from them, it is also used for migraines, headaches, muscle pain, TMJ, and hyperhidrosis. So it has various roles in not just reversing the signs of aging, but also in getting relief from such kind of pain, which somewhere arises due to involvement of muscles. So if we have blocked the signals for muscles to further get strengthened up or further get into a state of contraction, half of the problems on its own just gets resolved. So here we are using that property of neurotoxin, that is the Botox, to get relieve the patient from such pains. Now let's quickly revise up the facial muscles, because in any of the ways we are working off on the muscles of the face, either for relieving the patient from pain or for reversing the signs of aging. So though we have discussed the anatomy part in our previous webinar, but for a quick review of the topic, you can just go through how these distribution of various facial muscles, or let's say muscles of facial expressions, where are they present and how they are just distributed all around the face. So this picture you can just quickly look at. Now let's see the Botox treatment areas. So just now we have mentioned the signs of aging here on the forehead in form of what? Horizontal forehead lines. Like this, you just see the sign of aging, horizontal forehead lines here. Here in the glabellar region, the sign which just now I've mentioned, that parallel, one sign in this region you get. Here we just get the sagging brow. With age, with the time, this brow gets downward, it shows downward deflection. Here in this region we get crow's feet. Here somewhere here we get lower eyelids. What basically they it shows sagging, or they show sag like structures due to herniation of the orbital fats. It's again the sign of aging. Here we get bunny lines. Then in this area, the problem can be of gummy smile. What is that? You know, when person smiles, if a more than normal amount of gum is visible, that not looks nice. That is called as gummy smile. So it can be used for gummy smiles even. Then here in this area, we may encounter smoker's lines around the mouth. Somewhere here, drooping corners of the mouth. Then and the region of platysmal muscle, platysmal neck bands. Here you can see as a sign of aging the prominent square jaw or overdeveloped masseter muscles, dimpling of the chin in this area, then lip augmentation it is used for, and so on. So what the common thing all around the face, all those problems which are either mentioned as sign of aging or something which are developmental anomaly, what the common thing which you are encountering is somewhere or every in under every problem, the etiology is the muscle is somewhere in any of the ways it is responsible. What if we make that muscle relaxed? And that can only be done if we are giving any kind of neuromuscular toxin to that area, right? Now let's talk about the upper face. So in upper face, we already have seen what the problems we may encounter. These three: forehead wrinkles, then one lines here in this area like that, then crow's feet here. So what will be the muscles which will be responsible for these problems, or what will be the muscles which we will be focusing on to resolve these problems? Will be frontalis, corrugator in this area, procerus, and orbicularis oculi, the concentric muscles in a circular band like fashion which are present all around the eye. So we will be taking into consideration any of these muscles if any such problem is present. So if we compare both of these diagrams, what we will find is, if suppose we are targeting the forehead wrinkles line this way, so you know we will be depositing, or we will be infusing the Botox solution in this area like that. So approx 5 or 6 points we have marked to address whole of the muscular mass, muscular bulk in this area. If we are if we want to get rid of those parallel level line, then like this we will mark the lines and then deposit the Botox solution here for the crow's feet appearance. So this is the upper face, and this is the distribution or the site, the way how we will be depositing Botox. So final result you can very well compare. This is the forehead wrinkles, and after Botox injections, after treatment is done, the problem is resolved, and the final profile of the patient is like this. Now, the next problem is of gummy smile. So for gummy smile, 3 to 5 units on each side is advisable. But the question arises, at what area we will be depositing the solution of that. So for that, it is the Yonsei point. So firstly, let's see what are the muscles involved in this area which are responsible for a gummy smile. Not for gummy smile, but for a normal smile. These are the muscles which elevate your lips. Already, you might be remembering those things which we have discussed in our last sessions in detailed description of the facial muscles and their function. So that time we have seen what are the muscles which are present here and which are responsible for various facial expressions. So here we will be targeting our zygomaticus major, zygomaticus minor, levator labii superioris, and levator labii superioris alechnesi, and in some way orbicularis oris. So it is the combination of these all muscles, which in a way will be targeting to resolve the problem of a gummy smile, so that the amount of gums which are visible may be reduced. So for that, the target area of ours will be this point, this A point. It is called as Yonsei point. How that will be, let's see how we will calculate this Yonsei point for resolving the problem of gummy smile, or for finding out that a specific point we will be depositing the Botox solution. So for that, we need to mark the ella of the nose. From ella of the nose, we will draw a horizontal line of 1 centimeter. And then from the upper border of the lip, we will draw a vertical line of 3 centimeter. The point where both of these two lines will meet will be the Yonsei point, where we have to, that the point A, this point where we will be depositing the solution of Botox. So now here in these pictures, you can compare the before and after result of the Botox injection for resolving the problem of a gummy smile. This is how a gummy smile looks like. See, amount of gingiva or amount of gums which are visible, and after that injection, the muscles in these areas are now in a flaccid paralysis stage, paralyzed stage. That's why they are not, getting contracted. They're in a relaxed state. That's why they are not elevating the lips as earlier, the amount of lips they were elevating earlier. That's why, the gums are now hidden, because the muscles which were responsible for lifting up the lips now are in a relaxed stage, and they're not serving their purpose. Now, next problem, or for which we can take the help of a Botox injection, is the masseter debulking. What does this mean? Sometime what happens due to hypertrophy of the masseter muscles, the lower jaw appearance, lower jaw looks like, gives a fatter appearance. So to get a slim face, lower jaw, just to get a sharp jawline, or to get a slimmer lower face, you go for masseter debulking. For that, we need to look for the area where we'll be depositing that Botox solution for masseter debulking. So the area marked over here is the safety zone where we will be depositing the solution. Now the question is where masseter is found. So if you can visualize over here we have the mandible, the ramus of the mandible. Here, in a vertical manner, the whole bulk of masseter is, let me show you in a diagram. Yes, here you can see it's a complete distribution of the masseter, this complete bulk in a vertical fashion all around the ramus of the mandible. It is present, but the question is where we will deposit the solution. For that, we will be drawing few of those lines. The very first line will be drawn from earlobe earlobe to the mouth corner line. And then we will mark the posterior border line of the masseter, angle of the masseter here, and then lower border of the masseter, and then anterior border line of the masseter. Simply by palpating, you can very well understand where are masseter mass is present. So you will simply mark the boundaries of the masseter and the lower border of the masseter, and one line which is passing from the corner of the mouth to the earlobe. And the area which will lie within all those four lines will be the safety area where you will be depositing the Botox solution. And the points will be marked approx 0.5 to 1 and 3 to 4 separate points you will mark in the whole of the safety area which you have achieved by drawing these lines. And all of those points will lie apart approx 0.5 to 1 centimeter from each other, and at least 1 centimeter above from the margin of the mandible. From here, this is the margin of the mandible. The lowest point will be approx 1.5 centimeter above them, and whole of these points will be approx 0.5 to 1 centimeter away from each other, and total of 3 to 4 to 5 points we will mark. And approx 20 to 30 units per side we will deposit the solution of Botox. So this is something which you need to note and understand, that every different area which we are targeting or focusing has a specific limit of Botox to be deposited. For Botox, already we have seen and discussed for uh, gummy smile area, the lip area, and so on. So kindly keep on noting the maximum dose which can be deposited in every area. For masseter debulking, 20 to 30 units per side you will be using. So our next point is, for we can use the Botox even for lip flip. So now you must have listened the term number of times, you must have seen it, lip filler. So now let's see how this lip flip and filler are the different things. So in lip flip, we are using Botox. Botox is injected into the upper lip. It relaxes the muscles above the upper lip, causing it to roll upward and giving it a fuller looking lip, right? And that lasts approx for 8 to 12 weeks. But in lip filler, what we are doing, we are giving hyaluronic acid as a filler into the upper and lower lips. What it do, it actually adds the volume and plumps up the lips and lasts for about a year. So in this lip area, where fillers, where Botox can be deposited, these are the various areas where we can deposit the Botox. The top lip, this one, the top lip, bottom lip, then orbicularis, oris muscles, all around the lip in a concentric manner it is present, right? Then the cupid bow, these top is the cupid bows, here you can deposit, and then corner of the mouth. So these are the various areas where Botox lip flip, for lip flip, Botox can be deposited. So here you can see and compare the result of lip flip after Botox injection. Now let's come on the problems or the pain areas where Botox can be of use. The very first one is the TMJ pain. So TMJ pain can either be due to involvement of temporalis muscle or the masseter one. So suppose it is the temporalis which is responsible, you will be depositing 7 to 10 units of Botox, and if masseter is responsible for this pain, approx 25 to 30 units of Botox you will be depositing for that, right? So now masseter, where that masseter is present, you already have seen. Now let's see where the temporalis is present, in the temporal area, like this. So here this is the presentation or the presence of masseter muscle. This is your temporalis muscle, right? These are the, in this way you will mark the areas where you will deposit the Botox injection for relief of pain. Now, the next point is Botox for excessive sweating, hyperhidrosis. Excessive sweating is the term for that is hyperhidrosis. So this is a pictorial representation of how the sweat glands, sebaceous glands, and all those are present in the dermal layer, and how they just get opened into the epidermis at the surface. They gives the secretion of sweat or the sebum. So for that, firstly, we need to mark those areas in the axilla. This is the axilla region, axilla which has been focused here. So where this is the whole area, actually we need to find those specific sites where our sweat glands are hyperactive, which are hyperactive, right? So we will be addressing those, for how we will be addressing those areas, how we'll find out those areas by doing this minor starch test and iodine test. For that, what you need to do is you will clean and dry the axilla thoroughly and completely. Then you will paint the entire underarm area with iodine solution or povidone iodine, or with pre-moistened betadine swabs or swab sticks. Then you will allow the solution to dry. This will take few seconds to approx 1 minute, right? Then what we'll do, we'll dust entire site evenly and very lightly with fine starch powder. Any commercially available cornstarch will be sufficient for that, and wipe off the excess. So in that way, what you will get this violet colored appearance over here. Presence of sweat will cause the mixture to turn. This will be turned in violet colored, making the solution of sweating discernible. Wait approximately for 10 to 15 minutes for the reaction to occur. And then in that way, whole of that area you will be marking with, this is the area where your sweat glands are hyperactive. So this is your area of interest where you will be doing the treatment for Botox to get rid of the condition of hyperhidrosis. So in that way, now you have achieved that area. You will outline this area or circle the area of excessive sweating with a surgical marker or dermographic pen. The area may appear as an circular oval or it may appear as multiple areas like islands. Clean off excess starch and iodine solution. And then again use a surgical marker or dermographic pen to identify location within the sweating areas that are 1 point. Again, see, whole of that area you have to demarcate, you have to mark the various points so that at every single point you can deposit the desired solution or the prescribed solution or the units of Botox. But for that, you have to do the for getting that even distribution, you need to mark the points at a certain distance, which will be 1.5 centimeter apart from each other. Then see what is written here. Because on a botulinum toxin A, that is Botox, diffuses under the skin to a diameter of approx 2 centimeters, it recommended that physicians administer the injection at sites 1.5 centimeter apart in order to provide uninterrupted coverage and treatment of this area. This technique helps to limit any area of no effect. Prepare the area with antimicrobial solution, and then Botox is administered via an intradermal injection. Then whole of this Botox will diffuse in the skin in a ring of approx 2 centimeter in diameter, and points of injection should be evenly spaced 1.5 centimeter apart and demarcated before proceeding. 12 to 15 injection sites are typical. The clinician will need to divide 50 units evenly among the injection sites per axilla. So I think now you must have understood how we will get rid of all those commonly seen or commonly encountered problems. So far, we have seen a few of those problems which were related to signs of aging. Then we have seen the chief complaints regarding pain, either TMJ pain or this hyperhidrosis. Also, we have seen how we will be seeing encounter, if suppose we encounter any such problem, what will be the dose which we will infuse, how we will make the dilution, everything now in detail we have seen. So now let's wind up with the final doses, units and doses. So as a rule, 50 units are administered into each axilla, one injected intradermally using sterile 30 gauze needles, making the injections as equally spaced as possible over the area of hyperhidrosis, separated by 1 to 2 centimeter, depending upon the size of the area to be treated. Typically, 25 injections are made per axilla, injecting 0.1 ml, that is 2 units at each side. So this was all about our today's discussion regarding Botox. Hope you have understood that, and you are most welcome with any question or queries. So most probably in our upcoming sessions, we will be taking all those treatment modalities which in the previous session we have discussed. So in a little bit detail, we can talk about of each of those. So this was about Botox. Let's see in coming future, we may be discussing about the fillers, then we have PRP, PRFs, and so on. So ending up with the session from my side. Vijay ji,
Thank you, doctor. Thank you so much.
most welcome.
Yeah,
So we can proceed with the quiz or the questions if anybody have.
question, doctor. We have some questions on the chat box. Uh, Dr. Mega, yes, we will drop the registration link form. Dr. Divya is asking indication to use Botox in migraine, ma'am. Doctor, am I audible? Doctor, am I audible to you? Doctor's QR code is given on the screen. You can scan the QR code and submit the form, or else I'll also drop the certification link. You can just click on the link and submit the form to get your certificates, or also you can scan the QR code which is present on the screen. I will also drop the quiz form. Please do attend the quiz. Dr. Prachi?
Mr. Vijay, am I audible?
Yeah, now we are audible. Now we are audible. There are some questions. I'll read it out for you.
Yes, I've opened the chat box and I'm
Yeah,
going through the questions.
yeah, Doctor.
So let's take up. Can you please read that questions? I have just lost off with the.
Sure, Doctor. Dr. Divya is asking indication to use Botox in migraine.
Yes, see, I have mentioned that indication that it is used in that, but why I haven't discussed that in detail because it is beyond my scope, it's beyond my region. So for that, you'll have to consider the specialized person for that, though it is indicated in that for that region. I mean, if one has to treat that Botox, give the Botox injection for migraine purpose, you will have to make out what specific, specific muscles are involved which are hyper in a hyperactive state. You will have to resolve that, but for that either neuros will be more suitable for answer that in detail.
Okay,
So
thank you,
you'll
Doctor.
have to in detail, or we from a point of view of head and neck region, from cosmetic point of view, and few of those things which are related to maxillofacial area, specifically that masseter, we have discussed the points and all those things in detail. But this migraine you need to go in detail with the specialized one.
Thank you, Doctor. Varun Kashyap is asking, can you please tell how to calculate dosage in various disorders?
In calculate, see, actually what you need to which the thing which is very important for us to understand is the dilution one, the dilution, how we will be making that dilution. So if you're already in in with the very beginning, I've just shown a chart where it was mentioned that as a safer side we have to at every area we have to deposit minimum 4 units. So for 4 units to be prepared, that depends upon the vial you are having, either that can be of 50 or 50 units or 100 unit. So accordingly to make final 4 units, you will be you will be selecting the amount of ns, the volume of ns. So that is done. But again, suppose the your area of interest is the whole face due to any cosmetic region or whatever, that shouldn't exceed in a session from above 80 units. That is something which you need to remember. Then keeping that aside also, we have discussed for few of those things like masseter debulking, then for gummy smiles, then for that, 10 to 20 units. If you forget everything, like specifically you forget also ki how much maximum doses we can give, just keep it to 10 to 20 units. That is it for any kind of problem. If you are addressing that for any facial any cosmetic purpose, let's say for forehead frowning, if you are using that, keep it to 10 to 20 units. That will be more than sufficient and that will be okay. How it is reversed? See, it has a downtime of approx 6 months. So after 6 months, on its own it goes.
What instrument we use for Botox treatment?
No specific instrument is as such required. Only we require is an insulin syringe for administering that. Otherwise, we just have a vial already, the vial which are available. In that, we can directly transfer our NS with any of the normal syringe which we are having. That is it. No such dedicated armamentarium, nothing a very expensive setup, no, nothing like that is required. The only things required is insulin syringe for administering them. That is it.
Dr. Vishal Kumar asks, before injecting Botox, should we check hypersensitive reaction?
See, hypersensitive reaction as such are not noticed from Botox, but still, if you want, as a safer side, before administering any of the external agent, you can just go for a normal allergy test. No harm in that. Nothing like that.
Uh, Dr. Durga is asking, ma'am, tell me, is it possible about hyperhidrosis treatment in palm region by Botox application?
Yes, of course, that they are useful in palm region even, but for that you will have to exactly in the same way as you have done that for axilla, you can do that and resolve that problem.
Doctors, I am again dropping you the quiz and certification registration links. Please submit your form for to get your certificates, and please attend the quiz from the given link. Dr. Shantanu is asking injection Botox in stroke and paralysis patient.
I haven't seen anyone using that for such kind of uh, so far. Otherwise, as already I have mentioned, if one is moving to such a complicated, see, we have kept it for from a point of view of aging problems and related issues of head and neck region. But this is something again I would say with a specialized person you will have to discuss, or we will have to look that in detail, but so far I haven't seen anyone using that for stroke or paralysis.
Um,
Further research are needed in these fields.
okay. Botox or bro lift? How is it done and how many units of for bro lift, please?
Again, for any, see, specifically the units already we have mentioned, but if you are using that per side, keeping that to again same thing, 10 to 20. Should I again repeat those slides where I have shown you the units? If you want, you can again go through the slides. For every procedure near about units are mentioned. If not specifically, if not mentioned, then also every side, per side, 10 to 20 units would be more than sufficient. Or you can be within that even, you can keep it to 10 units depending upon the area you are infusing that. So
Thank you,
10 to
doctor.
10 to 20 units per side per problem would be sufficient.
Thank you, doctor. Thank you for answering the questions. Now, doctors, please, I will again copy paste the links. Please do go and submit your form to get your certificates and attend the quiz using the given link. Varun Kashyap is asking absolute contradictions for Botox. You can unmute yourself now.
Absolute contraindications of any problems are obviously those if a patient is having any systemic issues, illness, or neuromuscular problems, if a patient is having any kind of autoimmune disorders, if a patient is having one who is completely fit and fine, healthy, and not showing any kind of allergic reaction in not having any kind of such history, obviously those are the suitable subjects for that. Otherwise, obviously one who is having any underlying issues related to neuromuscular disorders and like that, obviously there are strict contraindications for them, because obviously here you are using neurotoxins. So why that may further aggravate the condition rather than solving the issue. So one such biggest contraindication is any kind of neuromuscular disorder, neurological problems, muscular dystrophy kind of such conditions. So obviously, or any systemic, active systemic disease or disorder.
Uh, Dr. Laltamis, we will not talk about any brands or company in this session. It is a educative session. Thank you for that question. Doctor, actually, one of the user is asking which brands or company would you suggest, please? So,
I would just say the Botox companies and brands, you can explore yourself.
yeah, Doctor,
Let's
yeah, please, Doctor, go ahead. Oh, okay. Thank you, doctor. Thank you so much for this insightful session. We have personally learned a great deal, and I'm sure all the doctors here would agree with me. On behalf of everyone, I would extend our sincere gratitude to Dr. Prachi. It is kind of this engagement and participation that motivates us to organize more such webinars in the future. Thank you, doctors. Thank you for joining the session, and we have planned more session for the month of March. We will be releasing the calendar, and I think we also have one more webinar tomorrow, or not tomorrow, sorry. One sec. On, yes, tomorrow, which is on PCOS from Dr. Raiza Samuel. Please do attend the session and get your certificates and knowledge about the topic. Thank you so much for joining all. Thank you, doctor. Thank you so much.
thank you all for the patience listening.
Thank you, doctor. We'll end for the day. Thank you so much, doctor, and thank you for